425 million people are living with diabetes, and I'm one of them.
Estima-se que este número suba para 522 milhões em 2030.
Muchos millones más corren un alto riesgo.
La diabetes es un problema que tiene serias consecuencias y no va a desaparecer.
This is a serious problem, and probably by 2025 or 30, it'll be 1 in 10 people living with diabetes.
But we've let this go on for way too long. The prevalence of diabetes has doubled over the last few decades.
Our governments don't do anything about it. The number will just increase and continue increasing.
Governments really need to shift their attitudes in terms of recognizing that a lot of NCDs and their risk factors are not individual problems that require individual solutions. Population level approaches are the only way.
So the rising prevalence of diabetes has a big impact on government because these patients develop complications and make increasing demands on limited resources in our healthcare systems.
Direct medical costs per year is about $727 billion US dollars, more than combination of US, China's defense budget.
Governments have a huge role in the prevention of diabetes by ensuring that there is possibilities for safe walking, cycling, playing, awareness of the importance of healthy eating, but also to make sure that there's a health system, functioning health system in place where people can go towards, be detected on time, be counseled if needed, get the treatment if needed. All of that is not happening in most countries of the world.
It's important that it be tackled. It's important that diabetes be addressed from the onset, from the beginning, with screening, with education.
It's important to be aware and spot the signs early. There's a number of signs that can be detected, but it does require a functioning health system where people are checked on a regular basis, are made aware of this, and where then there's a follow-up when diabetes is diagnosed.
We need trained nurses, dietitians, physiotherapists, an interdisciplinary team to help patients change their lifestyle and to manage their risk with evidence-based drug treatments.
All the patient living with diabetes should have 100% access to the medicine or essential medical care. There's no stronger message that this person will die if you don't have access to insulin. Unless government subsidize the medical expenses, individuals will not afford to have other way to manage their diabetes.
If resources are put into diabetes education, diabetes screening at the beginning, it sure could brighten the light at the end of the tunnel.
We need to take action now because the growing burden of diabetes and the complications of heart attack and stroke is inexorable unless governments take action.
All of the tools are out there for governments to make a change, and what we really need now is to see a willingness.
We know what needs to be done, we can do it, and it will save a lot of human suffering, but also a lot of money to society.
The time is now. More than ever, the time is now.